Welcome to Madnani Facial Plastics and congratulations on having your facelift surgery with us. We are honored and excited to be part of your transformation journey. Typically before surgery, most of our patients have already spoken to me and we've come up with a surgical plan. Within about 2 to 3 weeks of the surgery, you will have a specific appointment with my nursing team, and they will review with you the specific before and after care required for facelift surgery with us. Common things to avoid before surgery are avoiding alcohol, avoiding any kind of blood thinners such as aspirin or Motrin or Advil, vitamin E, fish oil. Those are certain vitamins that tend to thin the blood. If you're a heavy smoker, please cut down or quit. That would be best. Vaping doesn't count. And nicotine patches don't count either because it's the nicotine that enters the bloodstream that can cause vasoconstriction and reduce the blood supply to the skin flaps and can compromise your healing. Those of you with poorly controlled diabetes, we typically like to wait. I get a lot of questions asking how much weight should I lose before facelift surgery. Typically, if you're expecting to lose more than 15-20 pounds, I suggest you hold off on the surgery until you've reached your weight goals. For the first few days after surgery, you're going to want to eat a soft diet, have plenty of fluids at home. There are some recovery items that we suggest that you purchase, and we'll send you an Amazon link to that. We'll also give you a little goodie bag during your dressing change appointment to try to get you started with the equipment required for the dressing changes. You'll also be sent a prescription, and your prescriptions will be sent to the pharmacy ahead of time. Typically, if you're undergoing facelift surgery, there's multiple prescriptions. There's a prescription for an antibiotic ointment, there's an antibiotic that's going to be sent, there's a nausea medication that's going to be sent, there's a pain pill that's going to be sent, and we also send you some relaxing medications prior. There's also some things you have to do to your face before surgery, such as washing with a specific soap around the ears and putting special ointments around your nose and around the ears as well. So my team will review that with you at your pre-op appointment. At the day of surgery, we want you to dress comfortably. Wear a zipper top or a button down. We don't want to be able to pull dressings or shirts or jackets over your ears after the surgery for at least a week or two, as you're going to have little incisions around the ear, and we don't want the earlobes to be affected by the clothing removal or removal of heavy jackets or anything like that. Come in with a comfortable pair of shorts or comfortable underwear, as well as if we're going to do a facial fat transfer. I usually obtain the fat from the lower abdomen or your thigh area, and we can usually determine the site at the day of surgery because we'll give you a gown and we can look at the best sites for the fat transfer. You're going to need a responsible adult to take you home after surgery. Because of the medications that we give you, we cannot let you leave our facility unattended. So you cannot take an Uber home, and we also have to wheelchair you out of the facility because you will have been medicated with us. It's just for your safety. Plus, you'll have to come back and see us the next day, so someone's going to have to bring you back. When you leave the office, you're going to have a bandage around your head. It's a little bulky. If you go to our YouTube channel, you will see some patients with the bandage on them, or if you've been following my social media, we post a lot of patients with these bandages on them. That bandage will stay on for about 24 hours, so you'll come back and see us the next day. And when you come in, our nursing team or my physician assistants or myself will change that bandage to a smaller bandage. During the first 24 hours and also overnight, you'll have some antibiotics to take. I suggest you take it easy, have a soft diet, drink plenty of fluids. Do not do anything of exertion or overdo anything. You just kind of want to rest. You don't want to be walking up and down heavy flights of stairs. You don't want to be bending over, tying shoelaces, picking up children, grandchildren, or heavy pets. You just want to sit back and relax. What you can expect the first night is some tenderness or discomfort, especially on the neck and around the ear area. Expect some drainage on the back of the dressing. You're going to have little tiny openings behind the ear on both sides with a little spacer called a penrose. That's going to allow fluid that accumulates to drain into the bandage, and it's normal to have some fluid collection on the back of the ears after surgery. And so we suggest you put a cover, and we're happy to give you one, a cover for your pillowcase so you don't dirty your pillowcase. So the next day when you come in, we'll change the bandage and we'll give you a fresh bandage that will be a lot cleaner. So for the first few days after surgery, I suggest you use some pads that will keep your pillow clean and you don't dirty anything too much with fluid from behind the ear after surgery. For the first week as well, you want to sleep with your head elevated about 30 to 40 degrees. Typically, I tell my patients, as long as your head is above your heart, you're okay. Some patients get a wedge pillow, some patients have a recliner. Do what's comfortable for you. The first day after surgery, you'll come into the office and our PA or nurse will see you and we will change the bandage on you. And we'll explain the wound care to you and your family member. At this point, you can shower. I suggest most patients shower from their neck down. If you have a hand shower, you can go ahead and shower the back of the head, but I don't want water falling directly on your face or directly on the sides of the ear. We don't want that to happen, as it's all delicate with the incisions around the ear. You can have water fall off your head, or you can wash with a wet washcloth. You'll wash the incisions with some Cetaphil soap, and then you can also put a little bit of the antibiotic ointment and then the Aquaphor, and then you're going to put the gauze pads. Then my nursing team will explain exactly how to do that, and we also have a YouTube video to show how that dressing change is done. Most patients take the pain medication for the first 24 to 48 hours after surgery. After that, most patients are just taking Tylenol. I suggest that if the pain is not significant, you stick with Tylenol during the daytime and take the narcotic pain medicine, maybe just to help you sleep at night. The swelling tends to get worse by the third and fourth day, and the bruising tends to get worse by the third and fourth day. Typical areas where you're going to see bruising is under the eye, around the ear, and on the lower neck area. During the first week, you'll be in touch with our office. During the daytime, you can reach out to us using the Clara app. At 1 week, you'll come back and see us for the suture removals. We'll take out most of the sutures, but we're going to leave some of them in there. Most of the sutures around the ear are dissolvable. Most of the facelift sutures are dissolvable. Chin sutures get removed at 1 week. Most of the hairline sutures up here get removed at 1 week. Upper eyelid sutures get removed at 1 week. At the 2-week appointment, the remaining sutures will be removed. So usually there's some remaining sutures on the corner of the eyes up here. There's some remaining sutures on the hair tuft up here or behind the ears. The bandage doesn't need to be worn anymore after 2 weeks. I have some patients that want to continue to wear it, and that's fine. So between the 7 and 14-day appointment, you only need to wear the bandage at night. After 14 days, you don't really need to wear the bandage anymore. Routine sequence of follow-up appointments are at 1 day, 1 week, 2 weeks, 1 month, 3 months, 6 months, and a year. That's typically how we see our patients. If you need to be seen for anything in between, for sure we'll be more than happy to see you. If you'd rather do a virtual appointment, we're more than happy to see you as well. Typical reasons for being seen more frequently are sometimes patients get extra swelling or what's called healing tissue or scar tissue around the ears or in the neck area. So sometimes we have to do what's called steroid injections or Kenalog injection to try to soften those scars. Sometimes patients need some laser skin resurfacing to further improve fine lines. We're more than happy to see you for that. Remember, all of our surgery patients for 1 year after surgery also receive a discount on non-invasive or non-surgical treatments for up to a year after surgery. So definitely ask us about that. We will also recommend some good skincare for you to use after surgery, especially for those patients that are having laser skin resurfacing. We want you to be able to protect your investment on your face. So that combined with skincare and further laser treatments are things that you can do. For maintenance after surgery, typically we suggest you undergo some kind of laser skin resurfacing, some kind of skin tightening procedure, whether it's microneedling with radiofrequency, oral therapy about once a year. Keep up with some good skincare, keep up with your Botox and filler as needed, and avoid excessive sun exposure. Keep your weight where it's at, eat healthy, and try not to smoke. All those things will further maintain the results that we've done for you and also maintain your youthfulness over time. Hang in there. It's a process. It's a journey. We're here with you. Anything you need, please reach out to us via the Clara app or call the office. And thank you again for choosing us for your facelift procedure.